red flags we should be aware of. These signs may indicate underlying hormonal dysfunction that warrants medical evaluation before or instead of hydrotherapy. So awareness of these patterns help ensure client safety and supports coordinated care. In terms of the menstrual and reproductive red flags, these signs may indicate hormonal imbalance, structural issues, or underlying pathology that should be evaluated by a medical professional. The first is amenorrhea, lack of menstrual cycle for 3 months or more. This may reflect thyroid dysfunction, PCOS, hypothalamic stress, or other endocrine disruptions. And you see extremely heavy bleeding that can signal fibroids, endometrial thickening, anemia, or hormonal imbalance. Severe menstrual pain. This may indicate endometriosis, adenomyosis, or inflammatory conditions. And when you have sudden cycle irregularities, this could reflect perimenopause, thyroid issues, or stress-related HPA axis disruption. And when you have postmenopausal bleeding, this always requires medical evaluation because it may indicate endometrial changes and may be the first sign of cancer. Why this matters for colonics. Hormonal instability can affect bowel motility, inflammation, and vascular integrity, making hydrotherapy inappropriate or unsafe until evaluated. Now, in terms of the thyroid related red flags, these signs may reflect hypothyroidism, hyperthyroidism, or autoimmune thyroid disease, all of which influence digestion and metabolism. You also have unexplained weight changes. This suggests metabolic dysregulation. Persistent fatigue may indicate low thyroid function or adrenal involvement. And constipation unresponsive to typical measures is a hallmark of hypothyroidism. You can have hair loss or thinning eyebrows. This is often associated with thyroid hormone imbalance. Because of the estrogen receptors in the heart, you can have palpitations. You can also have heat-cold intolerance. And these are possible signs of hyperthyroidism or adrenal dysregulation. And why this matters for colonics. Thyroid dysfunction affects gut motility and cardiovascular stability, which may increase risk during hydrotherapy. You can have adrenal and stress response red flags. This may indicate HPA axis dysregulation, chronic stress load, or cortisol imbalance. Chronic exhaustion suggests impaired stress recovery. Dizziness on standing may reflect cortisol and electrolyte imbalance. Persistent insomnia is often tied to cortisol rhythm disruption. Mood swings or irritability can be linked to adrenal stress or blood sugar instability. Salt cravings and low blood pressure may reflect adrenal involvement. And this matters to colonics because adrenal dysregulation can affect blood pressure, hydration, and stress tolerance. And these are very important safety considerations. In terms of blood sugar and metabolic red flags, these signs may indicate insulin resistance, hypoglycemia, or early metabolic dysfunction. Shakiness or sweating between meals suggests unstable blood sugar. Crashing after meals may reflect insulin spikes. Darkened skin patches is a sign of insulin, especially around the neck, the inner elbow, and the armpits. Suggest possible early diabetes indicators. And why this matters? Because blood sugar instability can affect energy, hydration, and safety during sessions. In the perimenopause and postmenopause red flags, these signs may indicate rapid hormonal shifts, neurological changes, or systemic inflammation. First is severe hot flashes or night sweats. This suggests significant estrogen fluctuation. Rapid cognitive changes may reflect hormonal, thyroid, or neurological concerns. New severe bloating or abdominal discomfort could indicate GI or pelvic pathology. And significant mood changes may reflect hormonal imbalance or stress response dysregulation. This matters for colonics because hormonal transitions can influence vascular tone, gut motility, and emotional regulation. And these are very important for safe treatments. Hormone-related GI red flags. These signs may indicate hormone gut axis disruption, inflammation, or cyclical pathology. When you have cyclical constipation or diarrhea, this suggests an estrogen-progesterone imbalance affecting motility. When there's severe bloating around cycle phases, this may reflect estrogen dominance, dysbiosis, or inflammatory conditions. And when you have GI symptoms with mood shifts, this indicates possible neurotransmitter or hormonal involvement. And this matters for colonics because hormone-driven GI symptoms may require endocrine or GI evaluation before hydrotherapy.